later on as well. Okay, so we start with this same PowerPoint slide that I also discussed on the male animal infertility. So it just shows that for those that are not fertile or are not able to procreate, they may be categorized into having temporary inability to procreate as being an infertile, or if it's a permanent state, the proper term is being sterile. Okay, the fecundity is now more the capacity of more offspring to be delivered by the mother. Okay, so let's having to say that pigs have higher fecundity as compared to horses and then cattle. Okay, and this is the major outline for the causes of female infertility. So take infertility that I use, this is only temporary. And we have ovarian dysfunctions, okay, causing an estrus, a typical estrus or of failure. Next, we have disorders of fertilization, where we have a problem on the joining or fertilization of the egg by the sperm. And then if fertilization happened but it didn't happen the way it should or as it normally as or how it normally happens. Okay, so for human included in a typical fertilization pregnancy, which is the pregnancy happening outside the uterus. Okay, so next we go to prenatal mortality, which fertilization was successful, but the pregnancy had problems going further the line. That's why it didn't go full term. Either mortality happened during the first months of pregnancy and up to the mid trimester or early third trimester, leading to abortion of the animal. And then the last one would be on the perinatal and neonatal mortality, which includes the disturbances or problems relating to parturition. Okay, so that's right after parturition or days or weeks after parturition. Okay, so let's get to it. The first problem on our fertility would be on the anestrus, and this could be caused just by physiologic or pathologic anestrus. For physiologic factors, we look into probably the animal is still not sexually mature. That's why it's physiologically anestrus, still anestrus. So you have to remember the different dates, the different months, okay, to consider knowing the sexual maturity of each of our farm animals. Okay, so as a start, for our ruminants, we look at them at 8 months to 10 months. Okay, and this would be your normal sizes. Okay, this does not include the miniature ones or the pygmy goats, etc. Okay, and as we know from your physiology 3, that the larger the animal is, the longer that it would take her, okay, to be sexually mature. Okay, so then if you're dealing with miniature animals, they would go into sexual maturity earlier than the bigger ones. Okay, for large ruminants, that would be 15 months. Okay, 15 to 18 months. Okay, so same as with your horses, that would be about 18 months. Okay, so next is during pregnancy. So this is, I was pregnant myself, so there is an estrus during the time of the whole pregnancy. Okay, but there's a variation, no? And you will learn it later on. It was actually slightly discussed already on the genetics of infertility. But later on, you will also learn that horses have gestational heat, okay? But generally, when the animal is pregnant, okay, she will not go into heat. The third one is on lactation. Normally, Actually, this is the same for our wildlife animals. When the dam is still lactating, it will not go into heat. That's why for the lions or the tigers, no, they would kill the cubs so that female tigers and the lioness would go into heat. So the lion or the tiger then would breed. Okay, so that's heart-wrenching reality. Okay, but yeah, it does happen. But for farm animals, at least, not really. Okay. Then we have our fourth factor, which is seasonal breeding, and we follow this with our sheep and our horses. There are certain months in a year that they do not go in estrus, and this is affected by the length of the daylight. Okay. Now we go to the other side, which is the true unestrus, because there's really a problem. Okay, this is now what we call the pathologic unestrus. And commonly, we look into nutritional deficiencies, okay, especially here in our country. We are a developing country, and several of our owners have difficulty providing the proper nutrition to their animals, okay? So that's why the main thing, okay, or like the primary thing that you have to ensure that the animal is healthy before they can really manifest being in heat or having that good level of libido. Okay. Next would be the aging, same as with humans. Okay, when you become senile or the more that you age, your ovaries, the quality of the eggs coming from your ovaries would also be affected. Okay, next, lactation stress. Okay, lactation, it's normal lactation will not uh, okay, subject you to estrus, right? But worse to that would be lactational stress. Okay, this is quite evident for dairy cattle because they produce a lot of milk, and their body suffers because of the transfer of major minerals from their body, specifically calcium, okay, from their bone going to the milk production. And this results to emaciation of some of these dairy cattle. So emaciation, poor body condition score, etc., and low negative energy after parturition. So the lactation becomes related to nutritional deficiency now. Okay, so that's where the stress is coming in. Okay. Lactation, the physiological state of lactation should not be stressful. Okay, nutritionally, we have to provide the proper nutrition for that. Okay, but if this is not done, the more that it becomes stressful. Okay, next would be the seasonal changes, and this would be quite related to what I already mentioned, but more so also climate changes, like we have catastrophes, etc. And this also affects the well-being of our reproductive animals. And then last would be if you see any pathologies on the ovaries or on the uterus of the animals, which will be discussed with you later on. Okay, now on the nutritional unestrus, these are a few of the major minerals that we have to look into to decipher, okay, if the cause of the anestrus is through nutrition. If the animal is thin, okay, so there is low energy source, it then inhibits the release of the luteinizing hormone. So there's really direct correlation between the minerals and the vitamins to the proper functioning of the reproductive organs, okay? Not only that, also the endocrine system, no, the pituitary glands, the hypothalamus. Okay, so these are these are directly connected to the nutrition of the animal. Okay, so that's why I'll look into letter B. That's vitamin A or E. That's why in the program that I would recommend to the farms, I really tell them to provide exogenous vitamin A, D, E on a monthly basis. Okay, so there is a good product in the market right now that I use for monthly injections, and I encourage them to do monthly weighing, and at this to do the vitamin A D E injections. And this is actually very promising because several of the farms would tell me that there's already improvement on the fertility and on the coat quality of the after implementing my recommendation. So this is really effective. Okay. Next, on letter C, that is also correlated with the calcium. So we know now that if there is low calcium in the blood, the animal may suffer from milk fever or hypocalcemia. And of course, we know that there should be proper ratio between the calcium and phosphorus, right? So that also affects the fertility of the animal. Okay. Carotene would be coming from your vitamin B as well, okay? And that would lead to decrease in progesterone, and we need that hormone for maintenance of pregnancy, right? And if not pregnant, this helps maintain regular cyclicity. So if this is low, we will have erratic heat cycles. Okay, so to have this beta carotene, you have to ensure that the vitamin B levels in the body of the animal would also be in the proper level. Okay, the cobalt, copper, and manganese are a few of the many trace minerals that we have to maintain in our farm animals. Okay, so to know if there is low cobalt, low copper, low manganese, and then review the ingredient or the feed analysis of the whatever concentrate or own mix that you are giving to your animals, and then compare it with the standard. So if it's low, you have to give up supplementation. Okay, so it is actually a basic, sorry, not a basic, because not many farms really realize this. Even with concentrate feeding, there may still be a need for you to give supplements, okay, trace mineral supplements. It depends on your flock or your herd. Okay, so it doesn't necessarily mean that you're already giving the concentrate, you're already giving this high quality forage. It would already be enough. Okay, but normally we do not really test this, not unless we see some patients, right? Okay, so that will be an indication for you that something may be lacking in your nutrition. So that's how you deal with it. Okay, you test your feeds, and then if there's any deficiency to the standard level, then have someone customize the additional trace minerals that you have to put in to the nutrition of your herd. Or if there is already an existing trace mineral mix, okay, so just add that. Now for the aging, you are given here the age range, okay, where the animals, mostly cows, are starting to have problems with their ovaries, okay, 30% for infertility. So you would think that 5 years is actually not too old yet, but that being considering if the cow is a dairy animal, so they get physically and nutritionally spent year on year, because they have to be pregnant every year, they have to lactate every year, and not only lactate but to give us really high levels of milk production. So the physical toll is too much. Okay, that's why even if they're just 5 years old, it may be that the age of their body is older than 5 years old. Okay, so that's it. But it's different with beef cattle because they do not really undergo this this lactation, the stress of this lactation or the pressure to produce a lot of milk. What they only need is for them to really heavy up or increase their body weight, no, for slaughtering purposes. Okay, so they don't age as much as dairy cattle. Okay, so, and this is true, I have handled a few to several dairy cattle already that are on this age range, okay, and some really had problematic ovaries already, okay, either with a cyst, okay, or or persistent corpus luteum, okay. Next, on the lactational stress, I already mentioned this as an example on the wild animals. We have the tigers and then the lioness. And for our farm animals here, the sow. Okay, so this is really evident, no? The sow would go back into heat usually 3 to 4 days in my experience. I don't have a lot of experience, but yes, I was able to at least um, have an event to appreciate that it's really true. 3 to 4 days after weaning the piglets, the sow would already go to heat. So we just have a range here of 4 to 8 days. And then for the cows, they would go into heat if they're healthy 21 days after parturition, because that's their normal estrous cycle. But we usually let that pass because of the voluntary waiting period, right, which is 60 days. So we wait until the later part of the 60th day or on the third estrous cycle, which is on the 63rd day. Okay, so that would really depend on the body condition score and energy balance of the animal. Okay. For the sheep, okay, this would be about, this is about 1.5 weeks. Sorry, one and a half months. So that's 6 weeks, right? Okay, so that's 6 weeks postpartum. Is when it's when they go back into heat. But normally with the sheep, what I would have the farms do is to have their lambs be with them for 2 months, okay. It's difficult, well, it's easier to really take care of goats than the care of sheep than goats. Here in the Philippines, I have lesser problems in terms of having to feed the sheep rather than the goats, okay. So sometimes with the sheep, no, they do not lose body condition uh, more than the goats after parturition. So it could be that you can do the weaning as early as 1 month parturition, after parturition, but normally it would be 1.5 months to 2 months. Okay, so that's 6 weeks to 8 weeks. Okay. And 2 weeks after weaning, okay, that's when they would go back into heat. And now for the mares, this is quite tricky, okay, because they really have a different reproductive events compared to the other farm animals. Their reproductive cycle is really a lot more complicated. So they have this full heat at 5 to 15 days postpartum. So you have to be good with looking at your calendar to really know that it's just full heat, okay? Because it normally happens. Okay, seasonal anestrus, this is guided with the photoperiod, okay, causing the changes in the luteinizing hormone secretion. Okay, such that this holds true for the sheep and the horses. When it's cold here in the Philippines, no, so the Burr months, there is shorter daylight, so there is then a decrease in GnRH secretion. So you would then have a problem with the normal satiety, okay? And so the breeding usually happens as when there is starting to have an increase in daylight, okay? So if you have these problems, but you have to breed the animal. Okay, so these are the cheat things that we do. So we administer GnRH, okay, exogenous, and this is available. Rarely, I mean, it's available worldwide, but unfortunately, the availability here in the Philippines is limited. Okay, I mean, you cannot easily find this in any of the, I mean, veterinary stores. So only very selected suppliers would really cater this type of hormones. Okay, or same as with, you know, poultry, we just do artificial lighting. It's easy for horses naman kasi they would be in their individual enclosures. They have their barns. And then also for sheep, no, they also have their own enclosures. So it's manageable to do the artificial lighting. This is just the figure to show you the estrous cycle of the mare in relation to the photo period. So you see that there are, as when there is increased daylight, so there will be ovulation, no? Look at the middle part. Ovulation, 4 hours. Okay. So you will have more normal estrous cycles during when the daylight hours would be greater. Okay. Now on the pathologies of either the ovary or the uterus, let's start with the ovary first. So if you have already reviewed your genetics of infertility, you will know that ovarian hyperplasia is actually related to genetics, and an identified breed would be this Swedish mountain cattle, or just Svalco or Svalras, okay, or calves with white color, which can appear as a recessive gene and it skips a generation. So incomplete penetrance means it is not present in every generation. It skips a generation, such that when it was observed in the grandparents, it may not be present in the parents, but will be seen in the grandchildren. Okay. And in the mares, okay, with inactive ovaries, it could be unilateral or bilateral, and that can be because of a chromosomal aberration, okay, which is instead of having two X, okay, now you see an XO, okay, so she is not entirely, or she is not a 100% female because her chromosomes doesn't have the second X, okay, and that would lead to having inactive ovaries, okay. With that, you will have low levels of plasma estrogen, okay, and a result would be having the one side or incomplete or complete development of the ovaries. Okay. For cattle, this can also be observed, and in animals that have complete bilateral ovarian hypoplasia, they would look like males. They would have ox horn, so they do not look feminine. Okay, they do not look, you know, because when you say bull, no, they appear bulky, right? Okay, so when you see that the females appearing bulky, looking like bulls, so it could be that they have this complete bilateral ovarian hypoplasia. So this is actually not only looking at the appearance, but more so you have to look into the reproductive system of this animal. Okay, look into if the animal has a narrow pelvis. You do rectal palpation, and then of course for the more professional ones, they would be able to really detect having a narrow pelvis, but for novice practitioners, this may present as a difficulty for you. But obviously, on the reproductive tract, on the external genitalia, this is already not developed, okay? And the animal is not undergoing estrus. And if you do rectal palpation and ultrasonography, you will observe that the ovaries are always inactive, okay? I mean, on a monthly basis or every 21 days, you would go in, do the palpation and ultrasonography, and there's no changes month on month of this animal. And if you try to insert a test tube or whatever device to really check the patency of the reproductive tract, okay, and the probe that you're using may not be progressive cranially, okay, into the reproductive tract. So it just shows that the reproductive tract is not developed, okay. So these are the many clinical signs that you have to look into to suspect that the animal is suffering from complete bilateral ovarian hypoplasia. Next, this is the abnormality that we often see in our cows. We have this free martin, wherein 90% of the female twin is sterile. Okay, so not only infertile, but permanently not able to procreate. So 90% would be sterile. And this would only happen if the sex of the twins are not the same. So if there are two females, you have no problem. If there are two males, there is no problem. But if one is a male and one is a female, then 90% of the time, it is a free martin. And we have already established a breed predilection, such as it is highest in the Holstein Friesian and in the Simmental. Okay? But at least, for the other beef cattle, we have Simmental and Charolais. The minimum, I mean, like yeah, yeah, the minimum prevalence is really, I mean, close to each other, 2.4 to 2.5. But at least for Holstein Friesian, the occurrence is, the starting prevalence is low. I was able to observe no free martins already. I was working with a dairy cattle farm, so we had this, I think, three already. I was able to see three free martins. So you may opt to still rear them up to the marketable age or marketable body weight. So they will not be bred, of course, and you will just sell them as meat. Okay, so for you to detect if the animal is really a free martin, you can do the Fincher pencil test or using a glass pipette, or you may use a commercial tool, the Jorvet, which I will show later on. But basically, the concept is for you to insert something in the vulva to detect to determine the possible length of the reproductive tract, and that will allow you to really diagnose if it is patent and if the animal is a free martin. Okay, so this is the commercial tool. We call this the Jorvet free martin probe, and you see on figure 10 the comparison of the normal hair, which the length of the end, okay, length of the end of the probe can pass through. Okay, unlike in the free martin heifer, only this like a tube end can only pass through. Okay, so it's as simple as that. So you really don't need to buy this commercial probe. You can just use your glass pipette, no? Glass, it's not glass pipette, glass tube. Glass tube. Okay. Furthermore, okay, we are already on the third factor, retained corpus luteum, which can also happen commonly, and it is associated with uterine pathology. This is quite common for these three farm animals. We have the cow, the ewe, and the sow. They have pyometra, mucometra, fetal mummification, or fetal maceration. So retained placenta just means that the body is thinking that it is still pregnant. That's why the CL is still not lysing, okay? And we need the CL for the maintenance of the pregnancy, still producing the progesterone, okay? So they think that they're pregnant, so pseudo pregnancy also, but not really that they were bred. So not necessarily that they were bred, but there's because there's something in the uterus, okay, be it pus or just water, no, or this already dead fetus. Okay, so it's giving incorrect signals to the brain, thinking that she is still pregnant. Okay, and so we have the sow here that can both have this pyometra and can also have pseudopregnancy or hydrometra. Okay, but commonly for pseudo pregnancy, we have the deer, okay? But this can also be doe as the goats, okay? And then we also have the mares, okay? These are the three common farm animals that would suffer from hydrometra or pseudo pregnancy. Okay, pseudo pregnancy doesn't necessarily have to be um, the doesn't have to be that the animal has been bred. Okay, I had cases that these are two goats without a buck, but they suffered from pseudo pregnancy because they were, I mean, this is just our suspicion and also the owner's suspicion. The goats were consuming poultry feeds that may have hormones, okay, that is disrupting their endocrine system, giving wrong signals that the animal is pregnant. Okay, and when I did the ultrasound, sure enough that the uterus is filled with water. So imagine the initial body weight of the doe was I think 75, okay, 75 kilograms. I no 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 sorry, um 45 kilograms, and then after treating her, she went down to 29 kilograms. Okay, so imagine the weight of the water that's being carried in the uterus. So that's hydrometra or pseudo pregnancy. And next, we have uterine pathologies, which could either be these three. We have the uterus didelphys. We have two uterus. Okay, then we have double cervix. We have two cervix. Okay, because ideally you only have one cervix, one uterine body. Then it will bifurcate into two horns. But it seems here we have two separate horns. Okay, so that's an abnormality. um, if you know, I mean, if you have identified that your animal has this, you can still impregnate her, but I would not really advise to breed her or to use her as a breeding, because this is an abnormality. So as soon as this is diagnosed, best that the animal will be slaughtered, no, will be sold as meat, because this should not be propagated. Also have the double vagina. It could be that there is also double cervix inside, but it could be that there is only double vagina outside, but what's inside is the normal one reproductive tract alone. Okay. Okay, now we're done with that. We go to the next atypical estrus. It could be short estrus, it could be prolonged, it could be split, or it could be silent. Okay, so there are many types of atypical estrus. Commonly with your short estrus, this can be because the animal is still not very sexually mature yet. So or just over the transition from young to being sexually mature. So that's the quality of the estrus is not very good yet. Okay, and this is fine, no, for as long as you really ensure that the animal is healthy, and this will develop over the coming estrus cycles. Okay, next you have prolonged estrus cycle, meaning it could be an ovulatory, the egg is not being expelled, that's why the animal keeps on being in heat. Okay, because the end stage of the estrous cycle is the ovulation, and ovulation is not happening. So then the events before the ovulation, which is the estrus, or which is when the estrogen is very high, is prolonged. Okay, and this is a little bit normal, or I wouldn't say normal, but this usually happens because of seasonal estrus for the mares. Okay, more so the mares, but also because of the photoperiod in the mares and the sheep. So if you're changing the season, okay, this may happen. So you have to consider this if you are working with this type of animals, especially if you are going back to your home country, Japan, South Korea, which wherein you have winters, or you'd be working abroad where there are winters. So you have to consider this. Okay. Next would be split estrus. This also happens with mares starting on the breeding season. In and because mares, they really have a different reproductive cycle. That's why they're a little difficult to breed. They have a longer estrus period, okay? Yung estrus na heat period, okay? Not the whole estrus cycle, than the usual ruminants, okay? Their heat period, the true heat period, can last up to 7 days, okay? So that's why sometimes you have split estrus, um, and usually it happens on the start of the breeding season. So the management that you can do here is just take note, okay, that it's happening in the start of the breeding season, and just try to keep up that she will be bred before the end of the breeding season, okay? Because sometimes the breeding season is long naman for the horses. So if you don't get it right, or if they don't get pregnant the first time, hopefully you still have time to catch up, that they would be bred before the end of the breeding season. Okay. And it becomes tricky or more complicated only for race horses if they're going to be raised. Okay. But if not, okay, you have a leeway of really not going into the breeding season because you're not following the race horse industry season anyway, breeding season anyway. Okay, next, nymphomania, which can be very common with dairy cattle because this is directly connected with their nutrition and their lactation. So because they are producing milk and we want them to produce a lot of milk, so we feed them a lot, okay, and they become over conditioned, okay, and this build up of high concentrates and high protein can cause alterations on their ovaries, which makes them go into heat more often, okay. And for letter E, we have the carabaos for the silent heat. That's like their normal um, event already, not to really manifest their estrus pretty well compared to the other farm animals. So that can also be tricky. On the nymphomania, so this is what I mentioned earlier, commonly being caused by cystic ovarian disease, and this is very common with the dairy cattle more so the other animals. And the animal is not going into ovulation. She just keeps on having this frequent or irregular estrus lesser than 18 days. Okay, so that's one thing that you look into to really know that the animal is nymphomaniac. If it's not hitting the 21-day cycle, if it's coming back into heat even before that, so that's one of your major clues. Okay. And the others are just the external signs being shown as when the animal is in heat. Okay. So it doesn't necessarily mean, and when the animal is already nymphomaniac, the milk production decreases. Okay. But early on, usually, the reason why they go into nymphomania, because they're producing a lot. Okay. And when they produce a lot, the more they produce a lot, the more that you want to feed them with concentrates, and then okay, the domino effect happens as what I mentioned earlier. Okay, but once they are already have this cyst, one of the clinical signs would be decrease in net production. Okay, and this is an example of a follicular cystic ovary, and we have this on the right ovary. Unfortunately, the left ovary is not obvious in this picture. It's well hidden inside the lesser curvature of the left uterine horn. But normally, This size is just one fifth of what you are seeing right now on the right ovary. Okay, the normal ovarian size. So you see here that it's approximately 2 to 7 centimeters in diameter. So that's very large. So in my experience, I was able to palpate, no, a cyst as big as a tennis ball. Tennis ball, yeah, tennis ball. And then a golf ball and a jackstone. Okay, those are the three that I can remember. Lastly, on the silent heat, okay, if you're missing the heats, because they really go into heat every 21 days, so that's why it's easy to really know when they're going to heat again. And if it's the 21 days, so it's either you did not do the heat monitoring properly, that's why you missed it, or it's really not going to hit. And this is a problem actually with carabaos. That's why it's difficult to reproduce them as compared to cattle. Same as with the short estrus, okay, this can also be exhibited by the young animals because they're not totally sexually mature yet. That's why, you cannot really expect them to deliver or yun to manifest the typical estrus behavior. Okay, so same as with the horses earlier, they really have this atypical estrus also. The sheep, okay, starting at the start of the breeding season and to the end of the breeding season. Okay, so almost similar attack, no, when you are tending to use and then into horses. Okay, you really have to consider their breeding season. Here in the Philippines, so far, um it seems we don't have a breeding season for the sheep. Okay, I have not handled a lot of sheep flocks yet to really um tell you of my experience, but so far they're being impregnated all year round naman. Okay. And yeah, for the dairy cattle, if you are milking them 3 times a day as to the normal twice a day, it could be that their body condition score is suffering again. So when they are not entirely healthy, they are not going into heat. Okay, so that's one of your factors. For the mares, if they are not totally, sexually mature yet, they're just maiden animals. So it could be that they're not exhibiting the true heat yet. Foal at foot, meaning that she recently um, underwent parturition. Okay, so that's why the first heat was silent. Okay, so this is similar as compared to the other farm animals as well. Okay, now we go to the third abnormality. We have the ovulatory failure. It could be that the ovulation is not happening at all, which is common in swine and horses as compared to cattle and sheep. Okay, the Graafian follicle reaches maturity, but it does not rupture. So the egg is not being released. So there is no egg to be fertilized by the sperm. Okay, and it leads to partial luteinization of the corpus luteum, no? So because ovulation is not happening. So next, we also have the cystic ovarian disease, which is very common in the dairy cattle and then the swine, rare in beef, okay, with the many reasons I already mentioned earlier. And the factors that would cause cystic ovarian disease would be your high milk production. It could be also because of the seasonal changes. It could be related to the genetics. It could be pituitary dysfunction and postpartum uterine infections. Yes, this is true. No, that's why we have to be very careful with letter E. Ensure that your animals will not have metritis because it makes them prone to cystic ovarian disease on the coming estrocycles. Okay. Aside from follicular cyst, which you will see on the left side, bottom left side, we can also have luteal cyst. And for you to determine via rectal palpation The follicular cyst would feel like a very big balloon with water inside, and even with slight touch, it can erupt. Okay, but with luteal cyst, it feels like a very hard ball that even if you pinch it, you will not be able to rupture it. Okay, but the sizes are not really different from each other. I mean, like luteal cyst can be as big as a tennis ball, a golf ball, a jackstone, same as what the sizes I had with the follicular cyst before. Okay. And if you do the ultrasound, so you will see that for the corpus luteum, you would have a very big, high, uh, a very big echogenic. So that's gray, no? Echogenic mass. But for the follicular cyst, you will have a very big hypoechoic mass, meaning there's water inside. Okay, so that's how it feels, no? A balloon with water inside. The lining or the follicular wall would be very thin, but for the luteal cyst wall, it would be very thick. Okay, and you see here on the very corner at the right, the very thick corpus luteal wall, no? When you cut them in half. Okay. Next, now we go to the disorders of the fertilization. We can have fertilization failure because we have either abnormal eggs or abnormal sperm. So for the abnormal eggs, commonly we look into the size. If it's a size, the shape. If it's not any of the normal, then that's already um, that's already a big factor for the fertilization to discontinue, okay, especially if the soda pelluticida is intact, okay. And we know from our previous courses that we really have to have a strong zona pellucida. It keeps the wall, or the zona pellucida ensures the aseptic environment, and it keeps the nourishment of the cytoplasm, etc., inside. Okay, so if this is ruptured, it is prone to infection. And how will the egg or the fetus really grow if it is infected, right? Okay. The sperm is very sensitive to environmental temperature. The ovary is the same but not as sensitive as the sperm. Okay. For the sperm, you have several abnormalities as well, morphological abnormalities or even nutritional abnormalities. From your male infertility lecture, you have the double tail, the no tail, no head, double head, etc., or even just a crooked tail, no? So anything not normal, okay, that will really already lead to um, and then the death of the spermatozoa. It will not be viable, it will not function, no, to propel to reach the egg. If we don't have problems with those, we can have problems with structural barriers, and it could be congenital because there is underdevelopment of one horn, okay, or underdevelopment of both horns, which is with a breed predilection, and it has been identified with the white heifer disease. If not congenital, it could be acquired because of trauma. So that's why we also have to be careful when we're learning how to do artificial insemination. We do not just poke and poke, okay, because where we induce injury or trauma, there might be growth, and this could be impediment or an obstruction for normal mating to happen. Okay. And if there is infection, for example, metritis, okay, so it injures the cellular, I mean the ovarian wall. And if it gets damaged, there will be scar tissue development after the damaged tissue. It contracts the the uterine wall, and it may cause, constriction, etc., etc., leading to the barrier that will lead to fertilization failure. Okay. Aside from that, we can also have ovarian adhesions, no? Adhesions could also be coming from trauma. Yun na yung sinabi ko, scar tissue, it will contract, okay? Okay, and then adhesions may happen. Next, on the hormonal, it happens more on the sheep rather than on the cattle because especially abroad, I'm not very sure with Japan and South Korea, if they are feeding their sheep with forage that's high in estrogens, no? And this could be subterranean clover, red clover. In US, UK, at least that I know, they are feeding cottonseed meal, okay, but not poultry litter. No, not poultry litter. But this is what I mentioned earlier as well with the two pseudo pregnancy cases that I said. Poultry feeds, no, the two those were consuming poultry feeds. So it could be that there are hormones in the poultry feeds. That's why they're having these reproductive problems. So it's, I would say it's a similar thing, you know, if you're feeding poultry litter to your animals, because poultry litter is being used as an animal feed in some places of the world because of the high protein. It's cheap, no? But we have to cook them first to ensure that there would be no pathogens. But there may be hormones in the poultry litter. That's why you have increased estrogen level, okay, as compared to the normal. That's causing these abnormalities. Okay, if you don't have any barrier, maybe you have a problem with the fertilization. A typical fertilization is happening because of old egg, okay? And the old egg can happen, would be coming from old animals, okay? And an effect or consequence of this old egg would be polyspermy. The zona pellucida may be not as strong. That's why multiple sperms can capacitate it as compared to just one, okay? But this is not necessarily all the time, okay? Because we have twins, even if for younger animals, right? So this is just one way to look at it if you have polysperm coming from an old animal, okay? Now, if you don't have problems with your fertilization, you proceed with the pregnancy, but about 40%, up to 40% would be lost on the first month, okay? And because we do our first intervention in pregnancy diagnosis on the first month, as early as 24 days, no? But usually we do it 30 days. A lot of these losses cannot be detected, okay? and and on your first intervention you would already see that the animal is not pregnant, no? So it could be pala that she was pregnant early on, but there was just embryonic mortality, okay? And this is because of stress, okay? Thermal stress, lactation stress, overcrowding, no, the age of the animal, and even factors coming from the semen. It may not be compatible with the egg, okay? So this also happens with humans. And it could be the egg itself or the sperm itself being the best quality because of carrying transferrin or an antigen, an anti-sperm antibody, anti-sperm factor coming from the egg, okay, that makes them not incompatible to each other. That's why the pregnancy is not going to term, okay? This is also one of the reason why we should be careful on giving them the forage, okay? Mimosine is present in ipil-ipil, okay? So, and we know that ipil-ipil is a legume, it is high in crude protein. So, if you have that, it would be good if you feed that to your animals, but not to recently bred animals, okay? Because if you give too much of this, it would, aside from it could lead to bloat, it can lead to low ovarian response, and that would lead to termination of the pregnancy, okay? Aside from ipil-ipil, you can also have, you should also refrain giving plants with estrogenic activity, you know, such as potato tubers, barley oats, basically high plants or like products, feed products high in carbohydrates. Okay, you don't want that. This is same as in humans, no? For people always eating French fries, etc. They get fat and then they have a lot of ovarian problem. So we call it the PCOS, polycystic ovarian syndrome. So that's the equivalent for humans. Okay, now the abortion, you only call it that when there's a termination of the pregnancy, when the fetus is of recognizable size already. Okay, and that is on the mid trimester. If you're talking about large ruminants or large animals, that's starting from the mid trimester up to probably uh, um right before parturition. Okay, so for the cattle, we have 283 days for our normal pregnancy. So if there is termination of pregnancy at the level of 260 days, so that is already indicative of abortion. Then we can also have that for the pigs. 114 is the gestation period. Okay, and termination happened at 110th day. And for the mare, that's nearly 300 plus. Okay, and then you have 290 days termination of the pregnancy. Okay, next, another information on abortion. So you have two kinds. It could be spontaneous abortion or induced abortion. So let's go first with induced. This is being done in New Zealand, okay, because they are very strict with their season in milking. Okay, they induce already. The animal is injected with PGF2 alpha and they're sacrificing the calf. Okay, but for those that with spontaneous abortion, it could be that the animal is not properly healthy. That's why the body already decided that it will terminate the pregnancy because it will not be able to take care of the pregnancy properly. Okay. And for the mares, 2/3 of the twin pregnancies are not successful. So if we detect any twin pregnancy, we will kill one twin, the smaller twin. Okay, we will sacrifice that, so the pregnancy will continue. Okay, and for Angora goats, they are prone to hypoglycemic stress. So if it happens, the body will decide to terminate the pregnancy. Okay. Other than that, our causes would be infectious. We have these different kinds. So you have to be familiar with these different diseases. And then we can also have non-infectious that would be, the stress, etc. Nutrition, yeah. And these are the non-infectious causes of abortion. We have intoxication, we have hormonal, we have genetic or chromosomal, we have physical, and other factors such as twinning, poor management, allergies, and anaphylaxis. Okay, and for sporadic abortion, I have already summarized them according to what type of pathogen. So we have bacterial, viral, protozoal, and fungal. And this is towards the end of the presentation, perinatal mortality, which happens after parturition, 48 to 72 hours. So we look into probably the pregnancy wasn't healthy. That's why the offspring is not healthy. It could be that colostrum was not taken in properly or the quality of the colostrum is poor. Okay, so we have to look into that. For neonatal mortality, the death happens a few weeks after life. So these are your several causes. It could be nutrition, it could be infection, omphalitis, navel ill, mycoplasmosis, respiratory distress, very common. Depending also if the parturition happened in the winter when it's very cold and there had been problem in the thermal regulation of the offspring. So it's prone to respiratory distress or then hypothermia. Okay. And these are your different factors or causes of neonatal mortality because of nutritional deficiencies. white muscle disease, okay, hypomagnesemia, piglet anemia, which is very common. That's why we automatically provide iron dextran already starting on the third year of life, and maybe have a second dose on the 6th to 7th days of life, okay? So for you to really know what's the problem, if the animal is weak, you have to get blood and submit it for blood chemistry for you to know which is deficient. And these are the different disorders during the gestation, parturition, and purpurium of the dam. During gestation, you can have several problems such as multiple pregnancy, hydroallantois, or this is excessive accumulation of water in the reproductive tract, but the animal is pregnant. Okay, so this is to differentiate it from pseudopregnancy. Then you also have prolonged gestation. So it could be that there is incorrect record keeping lang pala. Okay, that's why there's prolonged gestation, no? So this is a management problem. For parturition, if there is size mismatch, it could lead to dystocia, and dystocia is categorized either to fetal, maternal, or mechanical. And for purpurium, which is on right after parturition, there is retained placenta, which is related to the nutrition. It could be the animal suffering from infections leading to metritis, pyometra, endometritis, or persistence of the corpus luteum, even if there is no longer pregnancy. Okay. And lastly, it could be that the animal may suffer from prolapse, be it vaginal or uterine. And commonly, the recommendation for this is to call the animal because it recurs. Okay. It will be difficult to manage this type of animal. And this is the last slide. This is just a flow chart to show you the different interactions of atypical or pathologic labor, no, dystocia. These are the different factors that could lead depending on the category of your dystocia, if it's fetal, maternal, or mechanical. Okay? So that's our presentation for today. Thank you so much for coming. I hope you learned a lot, and please prepare yourself for your coming quiz next week. That's all.